Our next speaker is T.Ravi, who will be speaking in place of his colleague Dr. Ashok Alate. Ravi will be speaking on why pharmaceutical companies need to provide information therapy. Ravi is Marketing Manager at Ferring Pharmaceuticals Private Limited.
Good afternoon. I'm standing in for Dr. Alate as Mr. Rajesh just pointed out. Mr. Ashok Jain, who just addressed before me, has taken a insight of how information therapy actually is at the level of the doctor's waiting room. So, which also happens to be the interface where I, coming from a pharmaceutical company, would be dealing with. We also seen the various speakers addressing these two facets, that is prosperity-related health issues. We are in a country where the geography and demographics range from one side we have birth control as one of the primary factors, and on the other side we have a booming segment of infertility which needs to be addressed. So the real challenge is, we recognize, I can talk for myself at least, that from the pharmaceutical industry, I realize that there is a real challenge which even Mr. Jain just addressed. Yes, and we also talked about that there is a rapidly increasing need for awareness, and there is also a high level of expectation from the service sectors. And today, yes, like Vandana or somebody talked about just some time back, that if she refuses to be a part of a program which should be treated, things have changed a little bit, at least in the urban areas where patients do have access to other alternatives. But from my perspective, I will deal of why does a pharmaceutical company need to be a part of this information therapy. Because pharmaceutical industry typically, and every company for the matter, is answerable to its stakeholders, and at the end of the day, every quarter the results are published of what is the profit that the company has achieved, and we are answerable to the stakeholders that way. So I'm trying to find the synergy of when we address a typical topic like information therapy, apart from other factors, how does it help the pharmaceutical company, and how does it go a long way in providing the total healthcare solution. So if you see the dynamics that we work on, typically is, first of all, when we look at the total healthcare scenario, total number of doctors across the country, the pharmaceutical industry typically talks about a factor called reach the customer. And when I say customer here, I am talking about the doctor. For us, the doctor is the customer and the patient is the consumer. So from that perspective, if we are in a chronic care segment, the objective would be to reach at least 80% of the customers. If you are wanting to be a sizable player, you have to reach at least 80% of the customers, that is to 80% of the doctors in that particular segment. This is definitely not applicable to large products or antibiotics where the reach would have, it is impossible to reach 200,000 general practitioners. But when you talk about diabetes, when you talk about cardiology, when you talk about nephrology, when you talk about infertility, these are sectors where if you want to be a reasonable player, you have to be aiming at least 80%. So reach is one of the important factors. And when we talk about reach, we are talking about the patient and the doctor. Where do they reach? That is the clinic. So typically, we are talking about how many clinics we reach. So then the next factor is when you're talking about reaching the care, that is a patient clinic, what is the number of exposures that I can aim for, and what is the cost per exposure? So that's why there is a large number of, you can see, many of your doctors here, you can see that each doctor today is being met by 2 or 3 divisions from the same company. Why does it happen? It is called, term typically in marketing language is called mirror field forces. This mirror field forces happens because we are trying to aim for multiple exposures. So if each doctor is being met twice in a month, 3 divisions are meeting the doctor, we achieve 6 exposures per month, and then the cost of exposure goes down drastically. And why this is being done? Because the large segments like diabetes, cardiology, these segments are growing very rapidly. So if you want to create an entry barrier for other companies to come in and want to get greater profits, one of the entry barriers is you can put in more number of people and create an entry barrier. And traditionally, the media that we have been using is the medical representative who meets the doctor. So all the information that flows from the pharmaceutical company to the customer or the consumer who is the patient has been only through the medical representative. And next important point is, if you want to be leader in your segment that you're operating in, we need to have continuous customer engagement. Like doctors need to continuously engage the patient by providing therapy information in a certain way. Similarly, from pharmaceutical company, it is important for us to continuously engage the customer. So when we put all these factors through and we see that our interface with the consumer is practically nil, our interface is only with the doctor, how do we extend that? One of the channels is information therapy. And the fact that there are so many companies, one of the ways to differentiate is information therapy. And the fact that the media is expanding so much and we are reaching to so many clinics, then one of the ways to ensure that the information therapy reaches is the way we can differentiate, and we can use multiple media, and this helps us in the long run. I'll deal with that in the next slide. And in all this, if we want to engage the doctor in a continuous program, then patient has to be the locus. The only way doctor would be interested in dealing with a pharmaceutical company is if there is a patient benefit at the end of it. So, Mr. Jain was talking about marketing myopia. So one of the ways is you ignore the patient, the consumer, then you are ignoring the doctor. So if I extend the value from marketing perspective, from a pharmaceutical company's perspective, extend the value chain through care is, if you are interfacing with the consumer, therapy focus, for example, simple changes like putting in a pack insert in regional languages. And pharmaceutical companies have the economies of scale. By economies of scale, I mean, so if say 50,000 units are being sold across the country, producing 5,000 units of patient education literature is possible to be put into the pack. So you can reach that many number of patients, and therefore the economies of scale are there with the pharmaceutical company, and that's why pharmaceutical companies can take care of information therapy. Need to differentiate and use of multiple media actually helps in providing 360-degree approach, besides of course the factors like quality of the medicine and ensuring the medicine is available and all this will ultimately help in giving better patient outcomes and improved perception of the brand. And that's what a pharmaceutical company needs to aim. At the end of the day, we are answerable stakeholders, and if the brand increases, therefore that's what we are aiming for. And if we keep the patient in the locus, in the loop, and information is provided at the right place at the right time, the quality of care is ensured. So if you see the synergy that I was trying to bring out, why a pharmaceutical company needs to be providing information therapy? Because ultimately by giving quality of care, at the end of the day, we are building a brand. Yes, there have been a lot of information that we have already been doing. What is the kind of information that has been doing? Yes, free camps are there, display of disease, a lot of patient support groups that we are talking about. Free counseling camps, we have done this in India in different languages. They could be focused on why a pharmaceutical company can focus on a particular segment. There could be a simple problem called bedwetting. Not many of you would have heard about it, but bedwetting is actually a problem and which can be treated. Because I'm in this segment, we have done a lot of work on bedwetting. There is a Children's Continence Society of India which has been formed by Ferring, and we didn't get much of response. And when we give patient information, usually it is left outside the clinic for the patient to pick it up. But then this is what we have been doing, and it helps us to focus. I'm bringing the point again here that economies of scale can actually help pharmaceutical companies to reach out to more number of audience and build a brand. So we focus on not only issues like bedwetting, we focus on issues like precocious puberty, which again is not a talked about subject, and infertility, myths and facts. This was one of the things, of course, we still are hampered by the fact that literacy is a problem, and many of these things need to be explained. So this is not a Ferring India initiative, it is Ferring across the world does initiatives on bedwetting. We have, like somebody was saying, that can we not have patient info toll-free lines? We've been doing that, toll-free lines across the globe. Also, one of the things that a pharmaceutical company can do is actually choose a brand ambassador which brings focus to the subject. So, which is something that I don't know how many other industries can do, and they are doing it, but this helps to bring a lot of focus to that particular disease area. And that, just like I talked about, patient groups, it also can be done. So, why pharmaceutical company needs to be in information therapy? It is obviously not a divorce from the fact that we need to produce profits. It is for the benefit of the patient and improving quality of care, and that's all I can talk about it. Thank you.